Hello and welcome. Thank you for joining today's session on managing persistent pain in football with a focus on integrating specialists and enhancing communication within teams. I'm in training grounds on a regular basis, and this topic is one that I frequently discuss with the medical teams. We're always looking at ways we can help with player availability, balancing the use of tech from our perspective on diagnostic ultrasound and shockwave, with creating a supportive, effective environment for both the athletes as well as the practitioners. So today I'm really looking forward to it. We've got Mark Leather, who I've known for a number of years and has worked at many elite teams, including Bolton, Mark, in the role of head physio and head of medical, as well as Richmond Stace, who's a chronic pain specialist who consults with various sports teams. So hope you found the session helpful. We've had a really good sign up on this. We've had over 100 people sign up, all from elite football. So I'm really looking forward to that. We're going to have a Q&A section at the end, so please put your questions in the Q&A and we'll come back to them then. So, guys, thank you for joining.
Good to be here.
Yep, thank you.
Cheers. So, Mark, starting with you, you've got a lot of experience in this area. What are the main things that should be considered when we're talking about chronic pain and working as a head of medical?
Well, I think it's just it's one piece of the jigsaw, really. I mean, we know that pain is multifactorial for very much an individualized perception or emotion, interpretation of it. It's really difficult to nail things down. And I think that, somebody once said to me years ago, a guy from rugby league was a bloke called Dean Bell, who was an ex-man of steel, a New Zealand warrior. And he said, you're either injured or you're hurt. And I understood that, really. If you're injured, you're injured. But if you're hurt just means it's painful. Some people can play with pain and some people can't play with pain. And in the era that I first started coming into football, it was almost a soft culture that if you were painful and you're sore and you didn't really get to the bottom of things, you were almost forced out there, embarrassed into playing. The usual statement of manning up for things, and it's old hat now. You can't really, I don't think, tell people to pay through the pain barrier, just carte blanche. You can't really do that. And I think in some ways that is quite inflammatory, because it's not our body, it's their body. And I think that when you're looking to sort of manage pain, I always think these days that we manage load. Load management is two buzzwords that's used throughout football performance and all sports performance departments. And maybe the pain management is something that we should take a little bit more maybe care of, really, a little bit more detail to it. And I feel that chronic pain is something that gets people down a little bit, really. Day after day, week after week, there's constantly this eating away at them. And characters that I've met have changed the persona a little bit with the longer that they're playing with these things or training with them, and we can't seem to get to the bottom of it. And I feel that in this day and age is a little bit easier. People are more open. It's okay to be in pain. It's okay to be struggling with your life or mental health and stress and anxiety. Whereas when I first came into it, people were hiding behind barriers, really, that were put up in front of them as almost, it was, you were too weak. And other teammates might be looking at them and questioning them, and certainly your head coach and managers, they would be definitely on the front foot to try and get to that.
Just on that, Mark, do you think that changed? Because I can still see there's still very much present from the management perspective. Do you feel like they are more understanding of the predicament of the modern player?
Well, I think that if you go back far enough, the manager was the manager of the club, and his title changed over time from being say a manager to a head coach. But ultimately, the power lay with the manager, not necessarily the players. And I think that what's changed, considerably is the amount of money and the power that players have. So the manager and the head coach really, generally speaking, at most clubs are on a short fuse. 6 games, 60 feet, and you're under pressure, you lose your job, which is a knock-on effect for everybody. Because right at the beginning, you said something about communication. And I think communication is really important. But if you keep changing your head coach and you keep changing the staff that come with that head coach, then the people that's left behind have got quite a difficult job in having a relationship, building a relationship and building communication and building this philosophy of how you work. Because it's just a conveyor belt. It's just one in, one out, or in some cases, 5 and 6 people in, 5 and 6 people out. And there's not really time in the calendar in those situations to build a rapport, not just with the head coach, but with the players themselves. And I think that's a bigger problem now than it used to be, because we've got less staff. We didn't have big departments of 20 people or 30 people or 15. It was very much a smaller team. So communication wasn't really an issue. There was only 3 or 4 of you. And therefore, communication was probably not one of the biggest problems. The problems in those days was hands to the pump, was providing enough of what was needed for all the players concerned. But I think that because of the pressures that the managers and coaches are under, then in the main, and I speak to quite a lot of the managers and coaches that I've worked with in the past that are still working in the game, it's still very much at the forefront that they want players on the pitch. They want them to go that extra mile. They want them to go through, if you like, the pain barriers we might talk about later in this webinar. And I think that privately, they might not necessarily agree with what they're actually telling players to do, but it's got to be driven. I think ourselves, some of us in the performance departments have probably been a bit guilty of looking at, maybe to a degree, the glass is half empty instead of half full. Players can do more. They can train harder. They can train smarter. They can play through certain injuries, but we have to try and get that across to players and also to the coach themselves, that isn't one size fits all. You can't say that for all players, and you can't say that for all injuries. But that's when building communication and rapport and teamwork, that maybe you can find out a little bit more about your players and how their psyche is, how they work and how they feel. And just because somebody is in a position of seniority in a performance department doesn't command respect. You only command respect by eventually being somebody that's honest, being reliable, trustworthy, clarity, and you give people an honest opinion. We used to call a spade, and that's the way that I've always worked. Be honest and upfront. Stop dilly-dallying around, coming around the bush. Be to the point of what you actually want these players to do. And moving on from that is seeking the right help and advice from external people as and when you need to do that. And I think we've talked about it before, about some of the external consultants that I've used in the past have really only been brought in when there's a crisis, complete disaster. Not in pain management, by the way, but I can remember a specific incident of inheriting some big project that one of the clubs I was working at in the Premier League, where before I joined, there was a major sort of root and branch external report about the coaching staff, the players, the medical, the sports science, the fitness side of things, done from an external person. And it obviously went down like a lead balloon with people because they were on the back front. They were very threatened by this, and it was done at the wrong time, which I think is another thing for tonight. Really, is one of the things that made me feel that if you're going to do something like that, there'll always be a threat to certain people, a perceived threat. It isn't a threat, but if you want it to be, it will be. So this business of bringing outside help is something that should be planned collaboratively within your team, and with communication and reasoning and rapport and relationship building with the head coach, because we're all after the same thing: player availability. We want them on the pitch for as long as we can, and we want to lengthen their careers, and they want to lengthen their own careers. So if we can try and get away from crisis and planning, it's almost as if it was towards the end of a season, looking back and auditing what you've done, discussion as a team, as what went well and what didn't go so well. What can we do to improve our department? And I think pain management, chronic pain is clearly one area that, should be at the forefront, because it's one of the reasons why they won't play, is if they're in some sort of abyss of pain day after day, grinding them down a little bit. So I think the timing of when you've introduced consultants is key, and that's what I did in 3 or 4 jobs at the highest level, was to bring in the right people who were the right characters, and then try and integrate them into the department as best you can, with a clear instruction that, they're there for a reason. If their speciality is nutrition or their speciality is pain management, then let them have and explain to the rest of the staff and the players as a group as to what they're there for. It doesn't matter really who does what, as long as we get the right outcome. And that leads us to more about the relationship that we have in our multidisciplinary team with each other. I lead 2 master's programs, and I was gobsmacked by some of the things that I'm picking up from, clubs all over the world, about how protective certain people in the multidisciplinary team are. Lack of communication, lack of clarity, holding on to things for too long, till all of a sudden, what could have been a relatively minor injury, as for one reason or another, has turned into quite a complicated, long drawn out problem. And then the blame culture starts to come in. We then lose our respect with the players. The coach is on your back. It's the second time he's broken down. And we've created a monster for ourselves. So I think the way you build your multidisciplinary team, your full-time staff, and the way that you use external consultants is really important. And the consultants that you choose, you hope that they are the right characters, not just to deal with staff, but to deal with players. And the fact that they are external, they're not in the goldfish bowl all the time. I cringe at some of the things that we've agreed to do when you're working in football full time and thinking, well, whatever possessed us to think that this guy was going to be fit? And it's because you're on a roller coaster, you're on the tidal wave. It's just you've been taken along with it, and then it usually doesn't work, and then it usually leads to a lot of trouble and a lot of unease, uncertainty. And I feel that that an external practitioner is vital in the way that they speak to players, and they get. It's not just about the pain side of things; it's about them as a person, and building a relationship with them that is no real threat. Whereas me as head of department coming to a player again might be a threat, because they'll know exactly what I'll do is to probably go into the head coach and have a conversation with him and say along the lines, he doesn't fancy playing. I've tried to convince him that it's okay to play with pain or train with pain, if that's the case. So I think there's multi-benefits, but equally, you get the wrong external consultant, just like we have the wrong appointments in our multidisciplinary team, you can have a problem. If it's done properly and planned, and it's a thorough sort of process that you put together, then would it cause any harm? No. Would it make everybody better? Possibly not. Would it make a few people able to play and manage their pain? Probably yes, it could. But that's not my area. That's Richmond's area. He'll talk about how he views that in a few minutes.
Yeah, I mean, yeah, Richmond. Let's come to you on that as well. Like, what's your experience on what we've covered so far? And then, as Mark was saying there about the pain angle.
Yeah, I mean, well, that's a great, you covered so much there, Mark. I was trying to sort of keep up, and but great points, around communication about player first, which I know can sound, I don't know, a bit trite, or like catchphrases and whatnot, but it's actually really important. And of course there are priorities and clubs, and you mentioned, the money and the pressures there. But the issue, as far as I see it, is that when there's a misunderstanding of, we're talking about persistent pain here, not or chronic pain, not acute pain. And I fully acknowledge that medical teams are brilliant at dealing with acute stuff and pitch side stuff, and that. What we're talking about here are the people that haven't got better as expected, and everyone's getting frustrated. And that includes, some that might slip under the radar a little bit. So, the niggles, and they sort of say, oh, I'm all right. And they're doing some training and some play, or maybe even quite a lot of training and play, but they're always on the couch. They're always coming in. There's something. And we spoke about this before, those that can seemingly sort of slip under the radar a bit. And everyone sort of goes, no, well, they're playing enough, so it doesn't really provoke any questions or discussion. So you've got that as well. And then the sort of the persistent issues where they're not able to get back, or they stop and all that happening. And that might be a minority, it might be a minority, but it takes a lot of resources. And this is someone's life and someone's career. And the two are inextricably linked, because when you understand pain and realize that the types of things that shape a pain experience include beliefs and expectations, anticipations. Pain is not grounded in the tissues of the body. The pain is not generated by tissues of the body. It's generated by body systems in certain circumstances, and based on many things that have happened before, and learnings and predictions and stuff. So we've got a much better view on what pain is as such, how it's being generated. And when you understand that, then the stories that the player, what they're telling you, starts to make sense. And we can make sense of the fact that they go and have scans and tests and all these things, and it doesn't necessarily show that much, or it shows something, maybe a bit of inflammation or a bit of this or a bit of that, but yet they're talking about this pain that they can't get through it. And this is not a weakness or a vulnerability. This is their actual experience. And it probably takes a hell of a lot of courage for a player to say that. They want to play. This is their thing. They want to play. So if they're saying to you that they feel they can't or don't, there's something going on, and it goes well beyond the tissues. And I know that most of the people listening will have a sense of that, but I think people just don't know what to do. I think that's often the issue. Well, how do we help these players? And the first step is always to listen, and to get the depth of what's going on, and to understand things like, well, what are their beliefs? They'd have been told all sorts of things over the years, and we all build up our beliefs about what pain is and what injury is, and the two are often conflated. Still, pain and injury are seen, as very well related, or even the same. But we've known for many years that that's not the case. The famous Pat Wall lecture in the 70s on pain and injury. So we've known that for a long time. But we need to understand what is it that person's thinking? What are their beliefs? Because that's driving their behaviors, it's driving their choices, their decisions, and it's massively influencing what it's actually like for them. So we need to know that. Because then we can start shaking the legs of any of the limiting beliefs that are contributing to this overall experience. And we can't sort of separate out what they're thinking, what they're perceiving, and how they're moving and acting, because it all comes together. So there's a lot that we can understand. There's a lot that we already understand that I think can be really, really helpful in these situations.
So I know that it's obviously, as part of being a clinician, is that you're going to be able to cover the psychology of things as well. But now with the role of the growing medical teams, as you mentioned, Mark, like where teams will have psychologists, certainly at the top level. Like, at what part does that play within the management of pain?
Is that to me?
Yeah, to you, yeah.
Don't get too technical, Tomo. I don't want to be going too deep. I'm a big believer in the psychological aspect of what we do. If somebody asked me if I had my time over again, what would I do differently? And I would say that I would stop so much screening and monitoring of all kinds of things that we do, from a biomechanical, musculoskeletal, you name it, we have coming out of the woodwork, and actually try and concentrate a bit more on who we're actually dealing with, the psyche of the individual that we, and just as a person, never mind a sportsman, a person, what are they like, these people? And, you know, why do so many people go off the radar, commit harry-carry, they just self-destruct, and they've got everything going for them, but there's something in their makeup that causes them to maybe go by the wayside. So I think it's a huge thing in life as well as sports, is this business of you know, the mental state of who you are and what you stand for, and how you get the best out of individuals. How do you get your best out of, you know, I'm a parent of 3 grown-up lads now, and each one of them has been dealt with by my wife and I in different ways. Because if I did the same way in terms of handling and developing a relationship with the oldest son, one way, which is my way or the highway, you do as you're told, no debate. He likes that, or he did do. Whereas the middle one would have no instigation of any conversation with me about anything like that. It would be straight to mum, and then mum would deal with it, usually giving him what he wanted to do. And I think footballers are no different than that, in that psychologically you need to know what you're dealing with and who you're dealing with. And as I've said before, this rapid turnover of staff and players doesn't leave much time to be able to develop that relationship that we want to do. I always used to say, you know, at Liverpool Football Club, one of the guys who would self-destruct, who thought he was the class clown, was the Robbie Fowlers of the world. He was a great footballer and a great lad, but misconceived, you know, in terms of the press. Because I can remember doing something with him, which was a psychometric type of situation where, you know, what did he not like about the game? And that was bad press. And I nearly fell off my chair. I said, you don't like bad press? No. I said, well, why do you feed the press with all the things that you've done? I won't go into them now what he did, but it was almost you don't want the bad press, but you're feeding the press with all the bad things that you've got up to. And it was really quite a telling time for him, really. But when he was injured long term with a serious knee injury, I got to know him really well. And you find out much more about the character and his family, his father, his mother, his sisters, his brother. And you know, suddenly this lad became he probably became a real person rather than just a footballer. And I think that's what we should try and do. And I know that we all try and do that with our patients or players that we're dealing with. But it's not easy, because there's such a busy flow of people and a to-ing and fro-ing of people. They're here today, gone tomorrow. And I don't think that the game lends itself to that anymore. It's too big. I mean, Chelsea Football Club, I think it was something like 45 pros. Still, how can you deal with that? how many staff have they got? I've no idea how many staff they've got, and it might not be an accurate uh, number to come out with that, but it was something that I've read and I thought, wow, that is a lot of personnel that you're trying to deal with and build relationships with. But I do think, go back to your original question, psychologically is huge in everything, whether the coach does that every day or should do, in how he deals with his players. And we're the same. We want to get the best out of a player during during their rehab. We should know how to deal with them as an individual, and pain is no different. Pain is exactly what we said right at the beginning. It's your own personal perception and interpretation of it, and therefore they have to be treated as an individual.
Yeah. Look, from your perspective at Richmond, then, so when you're going into these teams, like, what is your reaction if you've gone into a team? Like, who do you interact with, for one? And like, what's the standard experience that you've had, if there is a standard one?
Yeah, no, I mean, there hasn't been. It's been quite different. I mean, to be fair, I think that, when I've worked with a player, I've sort of been given not free rein to sort of get on. And usually they've already done a lot. They've tried. It's been within in-house, but they've gone and had lots of things done to them, and the classic sort of biomedical approaches, and try one thing after another. And that's not to be anti all of those, although sometimes you're like, really, but it's having the bigger picture right from the start. And again, Mark talked about having people involved. I'd much rather be involved sooner to see what's going on, and to help the medical team to identify the flags, essentially, to things to look out for. And it does take time, and you do have to get to know players, and so there is the challenge of the coming and going. But I don't think we need to use that as an excuse. I think we can still go in with that intent to build relationships, and essentially, if you sit there and listen to someone, it doesn't take long. It doesn't take long. The so-called soft skills. I mean, it's interesting in the therapy world, the approach of the therapist and the clinician is as important as any kind of technique or particular therapy that's used. Things like accurate empathy really matter, and so you can start bonding with people very quickly, and that is important. That is important. So yeah, I've sort of will work with the player, and my standard approach, if you like, in very broad brush terms, is first of all to listen to their story in great detail, and to pick out the nuance there, and to understand their experience, to step into their shoes, essentially, and see what it's like from their perspective, understand what their thinking's all about. And from that, then I can help them to understand their experiences. So, helping someone understand their pain and all the things that shape it, like some of the stuff I was talking about before, but drawing from their story to match that up, because it's got to be personalized and truly personalized. And from there, then obviously the end goal with a player is usually, getting back to playing. But before that, you've got the steps of getting back to training and such like. And then you design the steps from there. But the steps, would probably include some form of exercise or movement, but they're usually doing that sort of stuff. So it's much more in the understanding of how to go about their exercises and how to go about their rehab and their movements and such like. But also that big chunk of time outside of that. If you take the average person who has some kind of pain problem, and you ask them what they're doing, most of the time it's medication and some exercises. And then you might say, well, how long do you do these exercises for? And it would be amazing if someone said, I do an hour a day. This is in sort of Civvy Street, if you want to call it that. If someone said, I do an hour a day, I mean, that's a lot of exercise, isn't it? An hour a day. What do you reckon? I think that's quite a lot.
Yeah. Well, yeah, it depends what you define it as, but yeah.
Yeah. I'm talking about, you're kind of your regular person who's doing their physio exercises. Usually it's sort of 10, 15 minutes or something like that. Or I do it a couple of times a week, or whatever. So the point is if you're doing an hour a week, that's a lot. That's sorry, an hour a day, that's a lot. 7 hours a week. But most people are awake for 15 hours a day. So it's over 100 hours. Now you look at a footballer, obviously they're doing other things, and most of their work is around or training or rehab or S&C or that sort of stuff. But even so, they have a huge amount of downtime. Now, the point I'm making is that unless you address that other time, that what I call the waking hours, and someone's got ways that they're thinking and living that are taking them towards their picture of success, like getting back on the field, you're missing out on a massive chunk of time. A massive chunk of time. So in other words, the rehabilitation is really important, but it's not enough. There's other things that need to be considered. So a lot of the work that I do with people ends up around them learning how to get themselves into the right kind of state for any kind of training or S&C or rehab, knowing when to stop, how to work within their window of tolerance, how to progress it themselves, because it's not a straight line. It's not like week one this, week two that. Protocols don't work because protocols assume everybody is the same. It's completely conformist. No one's the same and no one's at the same point. So protocols fundamentally are not personalized. They can be opposite. And what we want for these players, in fact, what I want for anyone I work with, not just players, is that it's personalized. So it's got to be needs over numbers. Now, you look at the individual and whether they're male or female, and you look at the different patterns that they follow, maybe through the month or through the day or their life, and they need to be able to nuance what they're doing with that. There needs to be a dance going on with all of these things, not coming up like this. So personalized over or principles over protocols and needs over numbers. This is basic stuff for me that you help them to understand, so that then they're navigating their way forward. And often there's flare-ups. So you have those times where they've tried something, they've tried some training, or they've gone back to something or other, and but it hurt again. Now these are opportunities, flare-ups. I'm not a massive fan of that word, but I think everyone probably knows what I mean by those. Flare-ups are learning opportunities because it's a chance to look at how did they relate to it. No one chooses to be in pain. If you're in pain, you're in pain. It's already happening. You can't control that. You can't control outcomes or results. You can only control the process, and you can control and become skillful at how you relate to what's happening. When you realize that, suddenly the person's in that position to notice it, see what's going on, and navigate it, often with your help, until they develop the skills to do it themselves. So it's not what's happening as much as how you relate to it. Because what's happening, as I said, you can't control what's happening. Life just turns up. How you relate to it, that's the key. So this is a basic understanding of basic life principles, if you like, and human behavior. I don't mean psychology as such, because I see the whole anyway. As Andy, I don't sort of separate physical and mental, because examine your own experience for a moment. A thought, well, where's a thought? It's embodied. And actually the thoughts we have are driven by things like what's going on in your gut and your heart and such like as well. So, these are not abstract things. The mind is not just here. You are your mind. So
Yeah,
when you understand those things, their experiences make sense, because we've got to make sense of that person's actual experience, because that's what you're shaping.
So yeah, like you mentioned numbers and like it's the person over like KPIs and so on, and yet there's more numbers, more data in the game than ever before in life. Like I find it overwhelming with all the things that you can consume and do. And then bearing in mind we work in tech, so it's in our interest that tech's being used. But we've always been an advocate of it's used at the right times. Like Mark and I worked with isokinetics years and years ago, and that was one of the main things to be used. Whereas now there's data points everywhere. And what impact, Mark, does that play in it, good or bad?
Well, I think I like data, and so I like numbers, and I like some quantifiable data. But I think what I find certainly with leading to master's programs where you're constantly changing the content of the module with more resources, new technologies, it's forever changing. And I think that too much data can, be too complicated, and you can't see the wood for the trees. And we're not really sure. If you look at a simple measure of, say, a GPS monitor, what metrics do we use? How do we use them? When do we use them? What do they actually mean? And if you spoke to 10 different practitioners at 10 different clubs, they might take different metrics. They probably won't take them all differently. There'll be some that they use and put more weight behind than others. And they try and manage that, from their external load perspective. You've got other monitoring that's carried out every week, somebody's readiness to train and play, and you could have 101 things that's on the market that you could use, but you've got to use the time available cleverly to be able to get some reasonably reliable information that in the main would hopefully reduce the number of soft tissue, lower limb injuries, and if we got that alone, it would be absolutely marvelous. But we can't even reduce some injuries, despite what's available to us. Where there's been the last 4 or 5 years probably an upward spike of the incidence of soft tissue, lower limb injuries, and others, quite serious ones actually. And it sort of becomes a huge minefield. But I think that if somebody's in the situation that Richmond was mentioning, then I might be wrong, but I think sometimes you need to strip things down to just if you do the real basic things first, just sort of strip it back a little bit, and then try and build again with whatever strategy you're adopting for whatever you're looking to do. And in the terms of the pain management, that's one area that I'm sure that he will, Richmond will explain a little bit further. But I think that players can be confounded by and confused by data. Almost they become maybe wrapped up with it, too much wrapped up with it. Maybe we are as a performance department. Some coaches aren't particularly wrapped up with data. They don't particularly like all the data that we seem to take. Some do, some don't. And that becomes another issue working in this environment where your sports science and S&C and physios are quite happy to collect the data, and they like it, and they're trying to make some sense of it. And then the coaching staff almost poo-poo 50% of it, not bothered about it. We don't need that data. I know whether they're fit, and I do this, I do that. Then it becomes, a war of attrition really as to how you work with that. And I think that is similar to what we said before about educating the coach. And I don't mean it, from a blasé point of view. I mean, sitting with the coach, having a sensible conversation with him, because that person leads the football side of things. Got to have him on your side. Don't want to be at loggerheads. That's happened to me in the past. And once you do that, I knew in my previous experience, once you were being asked to do things that you shouldn't be doing, and you didn't really believe in, and you knew from the experts that you've called in to help make judgments, it wasn't the right thing to do. So therefore, knock on the door. I can't work like this. So we'll come to a gentlemanly agreement. How do I leave the football club? Because in the pecking order, we're down at the lower level. There's only one winner in that scenario. So it's not good to be in conflict, with various people. But I think that my experience will be when things aren't going well, you need to strip it down. But this is back to what I've said before about the timing of this. This shouldn't be a crisis use. It should be somebody like Richmond mentioned, about building rapport. And it won't take long. No, it won't. But what a great time to come in the middle, at the start of pre-season, when the players are in the building every morning, every afternoon, sometimes in the evening, going away on a pre-season. What a great way to develop your relationships with a new set of players. a new set of players getting on with their own new teammates, the new club they've joined, the new staff. Everybody is in that period. And that's why I think that window of 7 weeks in the summer, where you're living and breathing the game even more than you are through the season start, it's a great way to get to know and have little conversations with people. And I think for me, that would be a key take home from my perspective, is that all the external consultants would be useful to be starting at the beginning of the pre-season, or in some cases at the end of the last season, before they disappear. Let's use the example of a nutritionist. Why don't we get him in? If we've not already had one, you've probably got them. So I'm not talking about the bigger clubs where you've got probably 3 or 4 nutritionists in your club. But maybe that's a good time to get them sending their messages over the summer. This is how it's going to change. We're changing what we're doing. This is how it's going to work over the summer. And you come in and you're 3 steps ahead of your neighbours down the road, forward planning. And I think that is ideal if you can do that. But sadly, most of us don't even know we're in a job till June the 15th. Because you've not been told what's happening at your club since finishing in the middle of May. So it isn't ideal, but I think that for me would be the best time to bring them in and to have a real explanation of what the role is and what you are hoping to achieve, rather than, can you see this guy? Can't sort his hip out, can't sort his osteochondral defect in his ankle, his knee's blowing up, his back's knackered, and now he's got a knee problem, whatever it is. Crisis management never works.
Yeah, and particularly in that the sort of scenarios we're talking about, because I guess there's a hope that there's someone coming in, this will help, they'll be all right in a few weeks, and that completely unrealistic expectations. Yeah. Not saying there are, but there's a risk of that.
Yeah.
Whereas the reality is there's a lot of work that needs to be done with this player to help them to develop trust, for them to develop confidence in their body, for them to have good experiences of doing the various trainings and movements and such like, that need to be built over time in a non-linear fashion.
Yeah.
That's if you've got a relationship beforehand, or you're able to see that from an earlier stage, then obviously you're working with that, and may even then prevent that crisis, because obviously that's the best way, isn't it? Is to avoid this stuff.
That's exactly right. That's about the psychology as well. When we said before about psychology back in my time would only come in when you're bottom of the table. You're about to be relegated. Let's call the psychologist in. What are they going to do there? Don't give them a flipping ball to squeeze that and say, calm yourself down and reduce your stress. I mean, it's just crazy. But bringing in, say, for example, a sports psychologist approach, that's, again, do it when there's no games being played. Do it when there's no match situation. Do it properly, planned and prepped, and build it in. And I think that's the same with most new ways of working that you're deciding to do in a club. That's the best time to deliver it. Why do it when they're broken already?
Yeah, I mean, you're talking about skills, aren't we? We're talking about that person making decisions, practicing or learning and practicing new skills. And I often use the analogy to people, look, don't wait until you're in a really challenging moment to practice. You need to create a habit, and we help form a habit, because, it's very rare. I don't think I've ever met someone come and see me who already knew how to form habits. You need to know how to form habits to get a practice in place, to practice your skills, to get better. I mean, that's absolute basic. But if you're trying to learn something under pressure, you're closed down. You're not going to learn in the same way. I mean, look at kids at school when they're stressed and in a very difficult environment. Learning doesn't happen. I mean, this is something we talked about a lot before, in the environment of a club, the environment of the changing room, the environment of the medical rooms. If the person feels threatened because of their perception, and it's all about our perception. for whatever reason, we need to know about that so that we can create a safer environment, because overcoming these things is a learning process, and it simply won't happen if it's too stressful. Your body systems will not let it happen.
And I think another point on that is that we're all ego driven, really, to some degree in professional sport, but it's time to probably leave your ego in the car park, if that is a barrier. And I'm not saying it is with every practitioner, but I'm sure it is to some people, where they can't get somebody better. They can't get them consistently playing where they should be. This player is probably going seeing every Tom, Dick and Harry all over the place to try and get some sense out of what the situation is. It's gone on far too long. We've kept hold of it for far too long. We should have nipped it in the bud. Have that approach of using the expertise that we get. We don't read MRI scans ourselves as physios. If we are, it's a foolish thing to do. There's a consultant radiologist down the road. And if you don't like their reports, go and get another one. But let's not fiddle about with it. Reading an MRI scan and trying to ourselves, diagnose injuries like that. Just surround yourself with good people, sensible people, great personalities that can, as you use the word empathy, they're just good listeners as well. Listen to what they've got to say. Trouble with us, as a profession, maybe physiologists, we're always telling people what to do. They're halfway through a sentence and we're dipping in thinking that we've got the answer to the problem, and it's too big a job to look after 30, 40 professional footballers at the level that they're at, with the game at the intensity it's at. And I would definitely have a real core team of around you, the full-time staff that's in all the time. Clearly, yeah, that's what it's there for, with the usual reprobates. But then your other staff that's just as valuable, not necessarily with every player, but with certain groups of players, they become more, they sort of enhance your team, enhance the outcomes of what you're trying to do. And at the end of the day, if we've worked together as a team from day one, not this reactive crisis approach, then you're more likely to get some positive benefits from that. And we work better, we work collaboratively, we work more efficiently, we communicate better. There's no power struggle going on. I spoke to one Premier League club this last summer, and he was telling me, and I said, what, you fall out with other people in staff meetings? He said, oh yeah, physios are falling out with the sports scientists, the fitness coaches are falling out with the physios. And what about? Well, it was about rehab. You're falling out over a selection number of exercises. Is that and that's causing major disruption to the relationship that they've got within the team. And be rest assured, the footballers know exactly what's going on, because they can sense it and they can smell it when they walk in a room. There's some friction, and that is counterproductive. And so I think that acceptance of what we're good at, what our limitations are, and the benefits of other people that are coming in with no preconceived ideas about the athletes. We're not expecting them to make a Rolls Royce out of a Mini. We're expecting them to come in from a timely manner and be a part of the development and welfare of that football club's playing staff. And I'm sure that there are huge benefits to be gained, but where there's a will, there's a way. And I'm sure that I'm not really telling people things that they don't know already to a point, but I'm trying to encourage people with the wise old elder I am, heading towards semi-retirement, is that I don't want you to make the same mistakes that I possibly made. Some of them are horrendous things. And keep that approach that asking for help is not a sign of weakness. It's a real strength, and do it early, as early as you can. Then it's a win-win, no problem.
Yeah. No, great. No, I think there's definitely good points there about, I think, communication, ego. It's the same for everyone, but particularly in this environment, everyone wants to work in sport, and I think particularly in football, that does create a certain friction that the demand is so big in that area. I'm conscious we've got some questions that we've had pre-submitted, so I'm just going to go to the first one. This is from Gavin Blackwell, great guy, physio, and I have constant chats with Gavin about the good old days in football. So his question is managing of keeping the show on the road. The show is playing matches, fielding players, and hopefully winning. Players would often play with irritations regularly. It's a balance of staying in the team, carrying an injury, and often they would get forced out. And it's different now with bigger squads. Players want to be in the team with a problem rather than out of the team fit. So maintenance of treatment, any examples or insight around that? Richmond.
Yeah, I mean, I guess this is the tricky balance, and can only be taken on an individual level. I mean, pain can only be taken on an individual level, and some players are going to be happy with that. And I guess what you're looking at is performance, and you're taking their view on it. What's it like for them? Are they able to play and focus on the game, or are these sensations in their body intruding in that? And is that noticeable? Do the coaching staff, the managing staff sort of say, hey, what's up with him? He looked off his game, he was half a yard off the pace, or he would usually go in for that tackle. So you're kind of looking out for those things. There's different drivers going on, and different parts of the club will be pushing and pulling in different directions. But as you said, ultimately players want to play, and of course there's going to be a level of pain and discomfort by playing elite sport, absolutely. So I think it involves what we've been saying: relationships, communication, and keeping those channels open so that you can intervene when needed and say, look, between us, we reckon this is gone outside of a window of tolerance here. Now there's performance issues. Okay, so we don't want to pile pressure on the player. We want to help them get back within their window of tolerance. And the ways we would do that, there'd be lots of different ways we would do that, but it would always start by, everyone needs to understand that experience and what's shaping it and what's influencing it. And that's why understanding pain really matters, because then you can make sense of their lived experience, and it offers the ways forward.
Great. Thank you for that. And then I'm just going to go straight on to the next one. So, Mark, you mentioned imaging earlier on. So, from your experience, what's it been like where you've got a player that's experiencing or saying they've got pain, but imaging is showing nothing's coming up from the imaging?
Well, usually they've been pretty much one of the drivers of having maybe the scan in the first place. Is the player. I mean, I don't mean that we don't relish the numbers of imaging, and in some clubs it's irrelevant now. Most clubs actually in the Premier League, certainly in the Championship, and even maybe down to Division 1 to a degree, money isn't the object, and scanning is the first line of attack. And I can see why. Again, from my own experience, I got past the stage of trying to diagnose an injury. You would do that, but you'd be careful what you'd said before the scan was done, because they're not, in this day and age, it's a different breed of person. And there's so much information available to us. We would go with the scan. We would send the player to it for an MRI scan, if applicable, and we would use that as the benchmark to move from. Now, if there is nothing showing up on the scan, but he's in pain, then that's onto another appointment for somebody else to actually decide what that might be. We're assuming it's a musculoskeletal problem, always. Well, we're not, but in this conversation we might be tonight. We might be saying it's assuming that most of the injuries are musculoskeletal injuries. So if the scan comes back relatively normal and there's no sign of any previous injury, then we move into other investigations, as I'm sure that there are bigger and better practitioners than me listening to this, and that might involve medical information around blood tests. It might be involving nerve conduction studies. It could be P samples. It could be anything that is really trying to get to the bottom of that. And I don't doubt that that goes on at clubs anyway. If the scan comes back normal, we're not telling the player that there's nothing wrong with them at this stage. There must be a battery of other things that we do to try, and using other experts to have an opinion as to what they think is causing this guy's pain. And depending what that scenario is, it may be something quite straightforward that is causing them pain. Like, if you say somebody's like plantar fascia, for example, they're not always inflamed and torn. They might be sore. There might be a trigger point in there, and it might be tight, and that's all it requires is somebody to get the fingers in and give them a foam rolling and get this stuck in there and stretch the fascia out. It may be to do with neural firing up of the hamstring. Neural stretches, maybe shoving them in a slump test position and do a load of nerve stretches, sorts the problem out. That won't show up on an MRI scan. There's no damage to the hamstring tendon or muscle. So it's not that straightforward, your question, really, in a way. But if the scan comes back normal and the patient's in pain, I would have gone through a number of, if you like, a pathway of various things to do first, then second, it leads into this and that. Then when you've got a bigger picture, if he's still, or if the scan shows up something that is relatively minor, with no tissue damage to the muscle, like a bit of a myofascial tear or something like that. There's no damage to the muscle, which is better, but there's still going to be some pain. Is he okay to play with that? Well, that depends where it is, his previous history as to whether he's pulled this muscle or tendon, whatever it is, on previous occasions, the age of the player, the position of the player, the time of the season, the importance of the game, the risk and reward of playing for one game, and the risk of being out for the next 6 or 8 matches. And then if it's a re-injury, we're in that cycle again. And the person, if we've not already called in, will be calling Richmond in. Because it's now a chronic flipping hamstring strain or adductor strain that is now 3, 4, 5 months down the line, and he's still no nearer playing. Because we decided, the royal we, that he's okay to train and play, and he's retoned the muscle or whatever it is. So, I think that's the discussion with your teams as to how you work your department and what the process is and what's the plan of action in this scenario and that scenario. And then hopefully you make better decisions by doing that, rather than, as I've said, just, almost dealing with each case without too much thought and preparation of what might be the better pathway to take. You're in a bit of a rush, you're panicking, time's running out, and we need to make a decision. It's Thursday, he's training tomorrow, he's playing on Saturday. When really, earlier in the week, we knew he shouldn't have the conversation earlier in the week, go to the coach. If it's your job to go and communicate with the coach, you've got to do it. Don't hide the bad news. Tell him up front. But that's difficult to do if you're not too comfortable about falling out with people. But that's the role you've got.
Yeah, I mean, we've seen, we supply a lot of teams with diagnostic ultrasound, and that's a growing trend, even with some of the lower echelon teams as well. So it's quite an interesting dynamic as what role that plays before people being sent off for scans and so on. And Richmond, I've got a question here in regards to, are there any research or any experience with persistent pain with female athletes? Menstrual cycles, low iron, etc.
Yeah, for many years I worked with England women's rugby, so a lot of experience working there. Yeah, I mean, it's female biology is completely different to male biology. For whatever reason, most of the research has been done on male subjects, rats, and such, like the basic biology, and then extrapolated across. There's huge issues with, I mean, they even call it the gender pain gap. It's something I'm exploring a lot at the moment and writing on. But there are different considerations. But ultimately, what we're talking about is dealing with the person in front of us and coming to know, to understand someone's pain, you've got to understand the person. And of course, part of that will be, their gender. And then, you're finding a way forward together according to what you've found. I mean, I think people often ask for, well, what do you do? What do you do with people? Now, there's so many different, skills and strategies and things that you can bring in. You could sit here all night talking about them. There's no recipe. There's no, this is what you do. It's always personalized. So, my suggestion to people is that, once you get to know the person, their needs, their story, well, then what you can do to help. And as Mark's been saying, once you realize what you can do, then if there's other stuff that's necessary to meet that person's needs where they are right now, then you go and draw on that. You go and find those, and that's part of your role. As I said, that's a real strength to do that, because the important person here is the player. And we're serving them to give them the best chance of getting back to doing what they're doing.
Yeah. No, great, Mark.
Yeah, I was just going to say, just on that, and I think to always, generally with footballers, is that they know that your intentions are good. Everybody's intentions are good and well-founded. We're not there to deliberately become awkward with people or delay things, but I do believe that the sooner you get this sort of way of working, of not being too protective of your own area, and seek out help early, seek out more experts than I've always said, I think Tom a few times with you as well, is that the expert's the person that knows when to call in an expert. And I was told that years ago, and it's probably followed me all my career, really. Just surround yourself with people that know more than you do about a certain area. And I think if you do that, and you do it early, players appreciate that. And I think the staff do, and the coaching staff do. And I think that we'll not get it right all the time. But it won't be for the want of an organized, structured philosophy or strategy of how we work as a department. And players will accept that in the main. We've had all these people looking after you. We've done this, we've done that, and we maybe haven't sorted your problem out. We can't be 100%. But what we can be, I think, is better at being a bit more proactive and planning what we want to do. What are we based on, our department? Player availability. That is it. You can't tell how many goals Joe Bloggs is going to score, or how many penalties the goalkeeper saves, or whatever it is. It's at the end of the season, what has been the player availability throughout that department? And that, sadly, might not be your fault if player availability is poor, if you've recruited dreadfully. And how are you involved in the recruitment of footballers? You might be to a point. You organise the scans, and when it comes back a bit of undecided, a bit of a debate, they'll probably sign him anyway. And then you're stuck with him. And he might not break down, and he might be very good, or he probably doesn't play many games. And if he's come with a record of not playing many games, then why are we signing them? You can't control that. You can try and educate your sporting directors or your chief execs or whatever you've got at the football club, but ultimately we will probably be overruled. So we are looked at, unfortunately, for things that we're not necessarily directly in control of. Player availability, minutes played. That's a key thing. if the manager chooses to leave half a dozen people out of the squad because they're all fit, it's not because they're injured that they're not in the squad. There's too many players, which is pretty rare in elite football this last few years of that ever happening. But I think that comes back to what's your key performance indicator, and that is to player availability. How we do it, it's left to you as individuals that are working in your own environments to decide what you do. But I think it's worth embarking on that strategy if it's not being used already. It might be.
I think that's the key, isn't it? We're talking about the ultimate outcome of player availability. But the score takes care of itself. If you've read the classic Bill Walsh, we have no control over that bit. You have no control over a lot of bits. What you do have control over is your process over prize. I mean, I often use the analogy to people I work with. I say, you have no control over whether you reach those goals or not. Just like a football team can't say we're going to win 3-0. It'd be ridiculous if a manager was interviewed before and said we're going to win 3-0. I'd be like, well, there's another team trying to play here as well. You've got no control over the scores, results, outcomes. What you have control over is your process, how you go about playing your game. And this is exactly the same for us as clinicians and therapists. We can control that bit, what we do with that person, and how we help them. And then the types of help that we might bring in alongside that when needed. And then you're going to get an outcome. And it's going to be the best outcome you can get. But you can't control what that's going to be or when. You can't hasten things along. Nature will take its course. That's the uncomfortable reality. People don't like that. They want the certainty. No, when's the player going to be ready? Will they be ready on Saturday? Well, we're doing our best. But I can't guarantee it, no, because no one can. And if you say you are and you can, it's just not true. The crystal ball stuff, it's a real problem. It's a real problem. Because everyone's realistic from the start point and say, we're doing the best we can. We're going to focus on doing this. Then we're going to get some kind of result. And say that's the uncomfortable truth. But we can try and hide it, and then it causes more problems. Or we can go, all right, let's do our best. Let's focus on process over prize. And then the score takes care of itself.
Brilliant. Look, we've gone slightly over there, but we wanted to keep that going because some great conversation between you guys. So no, thank you very much for sharing that. It's a massive topic. There's a lot of things that we've covered in that space. And so for everyone that's watched this, thank you for joining. We're going to put this recording, it'll be sent out to you. It'll also be on our Academy page. From our side at PhysiQuip, we're always here to assist with anything, whether it's related to tech or education, or linking in with guys like Mark and Richmond, who are genuinely passionate about driving the industry forward and helping the space from the people involved as well as the players. So Mark, Richmond, thank you very much for sharing, and hopefully we can do something else soon.
Brilliant. Thanks.
Cheers, guys. Have a good evening.
Yep.